Hi everyone, I am Jay Miraclan, your second year student from Davao Doctors College. And so today I'm going to demonstrate the adult CPR and EAD skill CPR, or the cardiopulmonary resuscitation. Is a life-saving technique that is useful in many emergencies. It revives heart and lung from functioning, especially when there's no breathing and or no pulse visible. Now for the assessment and activation of proper asking for help to save time and energy by calling the ICLS immediately, then checking the pulse of the and breathing simultaneously can help to assure if the person has a heartbeat and any sign of breathing is visible. I am Jay Miraclan. I have my PPE. How may I help you? Check for the responsiveness by tapping a shoulder enough to wake her up for consciousness. Hey, are you okay? So check for the breathing and simultaneously for 10 seconds by placing a check if the person nose and mouth while looking for the abdomen and chest area, and check for the circulations by looking for the carotid pulse located to the neck to know if there is any circulations happening. So if a person or an infant is not responding, activate the emergency response system or send for the AED. In red, please call 911 and please tell them to bring AED and come back here immediately. So after calling the AMS, position on back, all the body parts are rolled over the same time in a hard surface as it allows to effective compressions of the sternum. Place the heel of a non-dominant hand on the center of the chest between the nipples and interlock with the dominant hand with the head tilt and face chin cleft, and then have 30 compressions with 2 breaths. Do these 5 cycles with a depth at least of 2 inches to create a blood flow during the compressions. Allows to remember the proper way of performing a CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So give 2 breaths using the barrier device. Each breath should be given within 1 second with visible chest rise shown with the resume compressing. 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So for the after doing the compressions and no sign of circulation are visible, AED arrives will analyze the heart rhythm, then complete checking and calling before turning on AED or the automated external defibrillator to help the heart to establish an effective rhythm again. Continue for cycle and check the patient's sign of circulation. So after doing the compressions and no signs of circulations are visible, AED arrives and it will analyze the heart rhythm and then complete checking the and calling before turning AED or the automated external defibrillator to help the heart reestablish an effective rhythm again. So AED has hazards such as no wet surface, no metallic surfaces, and no flammable gases should be avoided. Remove clothing and attach the pads correctly. Now place one on the upper right and side of the chest, and the other pad is the lower left side of the chest, few inches below the armpit. AED will analyze the heart, electrical rhythm, and will give a voice prompt analyzing the heart rhythm. Do not touch casually, and upon hearing that, stop chest compression and do not allow the others to touch casually.
Please wait. It is now safe to touch the patient. When instructed, give patient 30 rapid compressions. Press the patient's chest down rapidly, 1/3 depth of chest, then release. Start CPR. Press, 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 press. Stop compressions. Give breath. Give breath. Continue with compressions. Press, 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 press.
So when fully charged, it will give the prompt voice to press the shock button, and now clearly state that stand clear, ensure that no one is touching a casualty. Then press the clear state button if EAD prompts no shock advice. Restart the chest compression and immediately only stop CPR when the casualty start breathing normally or moving and regains the consciousness. Throughout this period, the IAD should remain connected to the casualty, so the casualty regains a normal breathing and the pulses. Recovery position, place him in the recovery position to prevent the tongue and the obstrucle the airway and the facilitate drainage of the mouth secretion. Extend the nearest you in the right angle of their body, and then their palm facing up, so the back of their hand rests on the cheek closest to you, and then hold in place. Use your free hand to bend the person's knee, and the farthest from you is the right arm.